I wanted to give you the perspective of really the bottom line is what I would affectionately call it as our practice on Mars, because it's a closed system. And in permanent medicine, we are the largest healthcare network in the country in regards to, if you look at the 8 regions of the country. We're primarily in the metropolitan areas all across the United States. My role is Southern California, heading up the national chiefs across the country, but then also focusing my attention on Southern California operations. So that being said, the key element here, and I had a conversation with folks at dinner last night, this is what I think the healthcare reform was going to look at in terms of how can doctors, hospitals, and health plans work together in a coordinated effort. And the other part of it is that San Diego, you heard kind of the reflections of 2 well-known urologists in the community. San Diego is the most hotly competitive healthcare market in the country. So one of my lines is the business line for Kaiser Permanente in San Diego, and our budget is of a $2 billion budget, 1,500 physicians, coordinating the care for 650,000 lives. That comes with it a lot of management, and at the end of this little presentation, I'll show you sort of a very interesting way that we're managing prostate cancer that is very relevant to what I've been hearing over the last couple of days. So that being said, the medical groups, like I said, it's a health plan, a foundation of hospitals, and the medical groups. So this is an accountable care organization. It's a single payer system. You hear a lot of this discussion about single payers in the state of California. We are the largest, obviously, in the state of California in regards to running healthcare in that state. The current governor is very much a health policy wonk, unlike Jerry Brown, who was not interested in healthcare. So I think there's going to be some changes going forward that will affect, to be frank, I think the rest of the country as far as the state of California in terms of what they're looking at moving forward. So this is the 8 regions of the country. As you can tell, these are primarily concentrated in metropolitan areas, like I said, responsible for 11.7 million lives. Urology-wise, we carry about close to 350 urologists in the country. Obviously a very large group, coordinated in care as an interregional group. So this is, in terms of in Southern California, that we have more than 9,000 physicians in this group of who are coordinating this care under a single payer system for now 4.7 million lives. What is different now in San Diego, I think, is that it's a unique geographical city in the sense that in the north, you're actually bordered by Camp Pendleton. And as far as the west, you have the ocean. In the south, you have the border to Mexico. And in the east, you have the desert and the national parks. So what I'm getting at is because you're in this environment where you're pseudo in an island, I think what has borne out in San Diego as far as that's concerned with the physician groups is a collaboration that occurs with contracting risk. There's a lot of risk share contracts that go on between medical groups. I think that it's a very healthy environment because the competition is very focused down in San Diego. As far as urology is concerned, there have been, both in research and education and clinical practice, we have a strong relationship over many years with UCSD as well as Genesis as far as a large LUGPA group in the county, sharing things, for example, in operations where if we're having some problems on the backlogs, we have worked together on that for several years. They were initially a contract with us for radiation oncology as an example. For Genesis, UCSD as an example has urology fellows who are part of the program. And then I will add that we also have another entity, the Balboa Naval Hospital, which is very unique. And as well, the military families, it's a very strong presence in San Diego. So it's a unique island with a lot of focus in terms of that medical care, coordination of medical care. So, the 6 pillars that support the philosophy of physicians, again, the biggest thing is physician-led. The doctors do make those decisions as to what we do in an evidence-based patient-centric, team-delivered, technology-enabled with culturally responsive care. And finally, this is my last slide. This is really a window into the work that we do. This is a shared decision-making model where you're taking patients, going through the screening process, and basically it involves a primary care physician to refer to this pathway as well, along with the urologist in Kaiser Permanente, and as well the green that you see are the biomarkers that we've been talking about. And so what this is actually trying to institute it is instituted over the last couple of years now, where we're actually using state-of-the-art markers in regards to understanding how can we best tackle things like folks who had had a previous negative biopsy, confirm MDX as a risk-shared contract. We basically go into understanding when to deploy fusion MRI. If you can imagine, in Southern California alone, I have 13 medical centers, 13 urology departments. They're all responsible for the urologic care. So to coordinate all this in terms of a big program with radiologists, the MRIs that are needed, the maintaining the quality, and what's interesting is not all 13 centers have the fusion MRI. What it is we actually have a rotating, if you will, a rotating truck that transfers the MRI machine, the fusion MRI to all the different spots in the Southern California. So we have 3 Urinav units that basically rotate along Southern California to really understand capital costs, but also to do a champion model to make sure that we have the right urologists who are devoted to instituting this as far as that's concerned. So I thought this was a useful backdrop to show you a window into how we actually do these things in our planet when we do urologic care. Thank you very much.